It is agony and despair for hundreds of patients in several counties across the country as more public hospitals are shut. Two more hospitals, that's Kapkatet and Nzawa Health Center, were shut down, leaving tens of patients stranded. This as a strike by nurses and clinical officers entered day 4 with no end in sight. And as Dorcas Wangira reports, a few counties such as Meru seem to have taken the dire situation seriously and brokered a deal with their healthcare workers to have services resume.
The Kapkatet Level 4 Sub-County Hospital in Kericho is deserted after it was closed Wednesday. There are only a few traces to show that patients and their caregivers were here. Broken window panes define the casualty entrance. This wheelchair, sharply juxtaposed with a door locked with chains and a padlock, is a near-perfect imagery for Kenya's state of healthcare and ailing hospitals, one in which the sick are turned away from the inside and healthcare workers stay away from the outside. In Machakos County Level 5 Referral Hospital, what strikes us first is this: a notice that instructs patients to use the back door. At the waiting bay at the outpatient unit, empty seats and unoccupied benches show that hardly any service is being offered. The farther we go, we find more padlocks and locked doors. At the maternity wing, we find more empty beds. Many mothers with newborns have been discharged.
Kutoka Monday kumekuwa matibabu imeharibika kabisa. Hatuna namna ya kwenda nyumbani na tulikuja hapa tukiwa tunataka kutibiwa.
Machakos Health CEC Dr. Ansent Kituku says medical officers seconded through UHC and others who are on contract are at work.
They need to consider counties which have been compliant to be used as good models for the others, so that these healthcare workers can come back and then they can urge the other counties to comply.
However, in some counties, normal operations continue in health facilities. This include Kirinyaga and Garissa. In Meru, the strike was suspended after the county government brokered a deal with the workers.
For those who will not be at their places of work on Monday, then we are going to take legal action.
In Nairobi, at the Mbagathi County Hospital, services were being offered, albeit by interns and contract staff.
Here at the Mama Lucy Kibaki Hospital, there are services still being offered.
If the environment is not safe, what makes you think that the locama that you want will work in the same environment? We will not allow our colleagues to come and work in those environments.
In a statement released on the status of the strike, Council of Governors Chairman Wycliffe Oparanya said that only 4 issues raised by the health workers' unions cut across all the 47 counties. This include permanent and pensionable employment, enhancement of risk allowances, declaration of COVID-19 as a work occupational hazard, and the establishment of a Health Services Commission. This, he said, would be addressed by a multi-agency approach. The rest, such as PPEs, health cover and promotions, would be sorted on a county-by-county basis. He further called for dialogue.
So who are we coming to reason with? And I think I want to ask the chair of the Council of Governors to please stop striking, because they are the ones on strike.
The unions maintain they will not relent until their demands are met, and that they will go to court to protect their right to strike and picket, and further bar the employer from intimidating healthcare workers on strike.
4 days into the nurses and clinical officers' strike, both sides, the unions and the 2 levels of government, are looking to the letter of the law to balance each side's scale. However, this is proving to put the lives of many patients at stake. When will this stalemate end? Dorcas Wangira, Citizen TV at the Mbagathi Hospital, Nairobi.